Assalamu alaikum my dear student. Once again welcome to my YouTube channel by the name MS Lectures, and today through this platform I will be explaining to you the very important topic, that is the metabolic alkalosis. So talking about the metabolic alkalosis and its causes. So first of all we have to understand the mechanism of the metabolic alkalosis. So in the metabolic alkalosis, what happens that the concentration of the bicarbonate ions actually increases, so which will lead to the metabolic alkalosis. So in the blood, what happens that the concentration of the bicarbonate ions in the body or in the blood increases. So due to the increase of the bicarbonate ions in the blood, what will happen that the metabolic alkalosis occurs. So what are the causes of the metabolic alkalosis? So talking about what are the causes of the metabolic alkalosis. So first cause is the vomiting. So vomiting is the contributing factor in causing the metabolic alkalosis, because in the vomiting loss of hydrogen ions occur. So due to the loss of hydrogen ions, there would be the you can say decrease in the concentration of the H ions. So decrease in the concentration of H ions would lead to the increased concentration of the bicarbonate ions comparatively, which would lead to the metabolic alkalosis. Secondly, intake of the bicarbonate ions. So intake of the bicarbonate ions can also lead to metabolic alkalosis, as you can say as it can increase the alkaline environment. Then we have the very important Cushing disease. So Cushing disease can also lead to the metabolic alkalosis. How? So in the Cushing disease, what happens that the renal cortex actually excretes more hormone. So due to the, you can say, more release of hormone by the renal cortex by the name aldosterone. So what does the aldosterone do? The aldosterone actually conserves the sodium ions into the blood. So we know that kidneys always operate on give and take mechanism. If they are intaking some ions, they would be excreting other ions. So aldosterone is conserving the sodium ions into the blood. So what would happen? By the conservation of the sodium ions, the kidneys would excrete the hydrogen ions excessive into the urine or into the tubular lumen. So that's why, due to the increased concentration of aldosterone, there would be more reservation of the sodium ions in the blood, which would lead to the more loss of H ions. So more loss of H ions would lead to the metabolic alkalosis. Number 4 cause, which is the hypokalemia. So number 4 cause is the hypokalemia. How hypokalemia can cause the metabolic alkalosis? So talking about the hypokalemia. So if there is the deficiency of the potassium ions into the blood, so what will happen? Kidneys would try to restore that potassium concentration. So what would happen? Kidneys would try to increase the concentration of the potassium ions in the blood, and ultimately what would happen? If they are restoring potassium ions, they would be excreting the hydrogen ions. So what would happen that the kidneys would increase the potassium ions into the blood vessel. So in the blood vessel is suffering from the hypokalemia. So kidneys would try to restore this potassium ion concentration and would increase the concentration of the potassium ions. So due to the restoration of the potassium ion into the blood, kidneys would excrete the hydrogen ions. So due to this mechanism, due to this restoration of the potassium ions and you can say really loss of hydrogen ion, metabolic alkalosis occurs. So I have explained you the 4 causes of the metabolic alkalosis and hope you have understood it well. Last but not the least, don't forget to subscribe MS Lectures. Thank you.